Welcome to the Turd Nerds. We are the functional gastroenterology podcast discussing all things poop. Before we take the plunge into today's episode, let us tell you a bit about ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and acupuncturist, and I specialize in all things gastroenterology, hormones, and fertility.
I'm Dr. Ami Kapadia, and I'm a medical doctor trained in family medicine and functional medicine with a special interest in gastrointestinal health, food and environmental allergies, and autoimmune disease.
And I'm Dr. Lana Gurvich, a naturopathic physician and acupuncturist who is board certified in naturopathic gastroenterology. I specialize in inflammatory bowel disease, IBS, and other functional digestive disorders. Let's jump into today's episode.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
Hey turds! Welcome. You'll notice if you're watching us on video, we have the Dr. Mark Davis joining us again. Yay! And we're changing gears. So we did our last episode. Tune into that. If you haven't, it's on fecal transplants. Wow, it's amazing. But today we are going to be discussing fiber.
Okay, so here is where I want to backstory this conversation. We personally, I know that both me and Mark and probably Dr. Sand agree that the best gastro conference in the whole world happens to be the Gastro Association of Naturopathic Physicians.
Yep.
We put a lot of energy into our guests.
So good.
And one of the things we did was we flew out Dr. Sharon Eldridge. She is a traditional naturopath out of New Zealand. I think she's actually retired at this point.
And PhD microbiologist, and she runs a SIBO lab.
Okay, so this woman's kind of amazing. And what happens is one of the things that the Gastro MP does is we have our first day, we call it pre-con, and it's a bunch of hands-on practicums. And there was this one practicum that Sharon did that Mark attended that I did not attend. And I promise you, I missed the event of the weekend. And so ever since then, Mark just got so jazzed about prebiotics that I was like, Mark, stop talking to me if it's on my camera. I want to know everything you learned.
Yeah, we literally stopped the conversation so we could record it for all of you.
So Mark got super into prebiotics.
Yeah, here's the thing. I've been practicing 15 years and I never used prebiotics that much, even though philosophically I believed in them.
Because I use food. Food is my prebiotic.
I just never kind of didn't have a mentor teach me how to do it. And so I didn't do it. But I went to her talk and she is super about prebiotics. She has 10 or 15 prebiotics in her office. And she does this mix of looking at people's microbiome results and listening to their symptoms and stuff. And then she mixes them up a blend and she gives it to me.
Wow, personalized
prebiotic blends.
That's amazing.
So just so we're on the same page, Mark Davis is now starting to form a company to make these personal. That's how jazzed he was.
Yeah, because here's the thing. I was like, I want to try this for myself, my patients. Let me just go out and look and let me get this combination of 5 prebiotics. Where can I get that? I was like, there must be a company that just blends them how you want. And there wasn't. It's not so it's actually, the website's up, customprebiotics.com. You can look at it. It's not actually ready to, the shop button isn't live yet.
So don't click that button.
It might be at this point.
Maybe.
Yeah.
It's true.
Yeah.
Okay, maybe click that button.
Maybe click it. And so I was like, well, I feel like I could do this. And so I got curious about it and started reading about all the prebiotics and started using them with my patients and figuring out how to blend them and different stuff. And I still have a lot to learn. I'm not an expert yet.
Okay. So when I'm thinking prebiotics, I am often thinking PHGG. I'm thinking inulin.
Yep.
My favorite.
I'm thinking psyllium.
What's your favorite? Psyllium.
I say often on this podcast, if I could get people to take psyllium and drink enough water, I could put myself out of business.
Great. Yeah.
I'm thinking acacia, guargum.
Yeah.
What are the 5 that you want?
Well, we have 20 to mix together because there's so many different combinations. We were like, oh, what are successful products out there that our companies we like are already making? And let's make sure we have all those ingredients so people can put those combinations together if they want.
So why blends over just single probiotics
or
prebiotics?
I think actually single prebiotics are great. And that's how I've been using them a lot.
That's how I use them.
Yeah, but Sharon, who's been doing this for decades, she likes these blends. So I plan to try to grow into the blends.
Yeah.
And I do a lot of microbiome testing. And I tell people all the time, we don't know a lot about how to interpret microbiome testing. There's a lot of guessing, but there's some guessing that prebiotics is a very good fit to guess with.
Okay. So give us an example. Or a clinical case.
Okay. So I still at this point am trying to learn from Sharon. Like I literally was like, Sharon, could we use your list? She's from New Zealand. I was like, Sharon, could we use your list and you teach us? And she was like, no, you're going to have to figure it out on your own.
That is
Well,
a
it's
very
been
good
long
Sharon,
time
by the
doing
way.
this already.
Yeah.
So I was like, okay, fine. So I still am mostly just doing what you guys are doing and giving singles or sometimes small combos based on symptoms and the literature.
Yeah.
So if I don't want to bloat somebody a lot, I give partially hydrolyzed guargum, the sun fiber. And and I love giving polyphenols because people respond very well to them. I also like psyllium. Weirdly, there's at least one trial in the literature where they give FMT versus FMT with psyllium, and they had better engraftment without psyllium. Like the psyllium kind of got in the way.
I wonder if psyllium just gooped it up.
I wonder if it gooped it up.
It is
So
goopy.
So now I'm like a little, because I use a lot of FMT, a little hesitant to give psyllium.
So do you give like powders? Do you have people blend it into food? Do you give it with probiotics? Do you do capsules?
I have done all of those.
Yeah.
So sometimes the doses I want ends up being a lot of capsules, like 20 capsules 2 or 3 times a day.
I do not do prebiotics as capsules.
Yeah.
I give them as powders.
But psyllium, like, people are not compliant with psyllium.
No,
disgusting.
I disagree.
I also disagree.
I think that there are certain people that is not going to be a good intervention. And then I am more likely to use powders that don't goop. So this is what, like, I'll use sun fiber, I'll use inulin, I'll use acacia. Even acacia is less goopy, you know?
But if you can get a routine in where you're like, oh, I have my little bit of applesauce or yogurt or a smoothie or something, and you put it in something and it does fine. Psyllium, I think, does fine.
I think I am just emotionally blocked from taking pills. I'm so over taking capsules.
And it ends up being a lot, like you were saying. If you're going to get fiber to any useful dose, it's like 9 pills a day.
Yeah, at least.
Yeah. Relative to what we learned from our FMT episode, that is a drop in the bucket. But for day to day, that is a lot.
Yeah. So I really, I tried to fill that hole because I was like, oh, there's a hole on the market of somebody who can just blend the prebiotics you want. And I will say, I talked to Megan Taylor, who is like our prebiotic queen. You should have her on this show.
Oh, we will.
Because I am also trying to learn from her. And she does a lot of combinations where she'll give singles a little bit first and trial stuff out and then combine things and look at microbiome reports. And so I'm still learning.
So how many of these microbiome reports have you run and what are you seeing? Because, okay, just so you guys know, Mark actually can read a microbiome report like people read tea leaves. Like it's like you can see the patterning.
That's not true. I literally tell people 75 to 80% of the time I get a microbiome report back and I really don't know what to do with it clinically. That's my spiel.
That's my problem with microbiome testing, period.
Yeah. And 10 or 15% of the time, I'm like, oh, this is terrible. I have some guesses. And 10 or 15% of the time, I'm like, this is great. We do not need to focus on your microbiome. And then the rest of the time, I'm like, man, look at that. A bunch of bugs.
Yeah. Okay. And so give us, what are you thinking? Like somebody with low akromansia or no akromansia. Is there something you would go for?
So we were like, in addition to just customizing them, we should give some blends to like do things like support akromansia growth. And unfortunately, so I don't have a clinical case and I did just recently go through all the literature and all we have is stuff in animals. We don't have human data. So we're really in the era of being cowboys about prebiotics. And like I said, I'm like giving sun fiber, I'm giving psyllium, I'm giving apple pectin, I'm giving like the galacto-oligosaccharides, sometimes the Bimuno.
Do you find that people tolerate it well when you give the combos versus just one at a time?
Well, yeah. I mean, if you get I have sometimes gotten a great hit. So I've used actually sun fiber and pectin, apple pectin together in a few different people. Like as we're giving them big courses of antibiotics, that's like sort of my favorite don't let antibiotics hurt your microbiome combo lately.
Over probiotics.
Yeah.
Or with probiotics.
Yeah, I give probiotics too. The probiotic literature is a little disappointing.
Yeah, I know.
Like lactobacillus and bifidobacteria probiotics do help reduce C. diff colitis, for example. But Josh Goldenberg did a meta-analysis on this, and the subset that really benefited was like the sickest ICU patients, and that's who's driving all the benefit. And so,
because that's so interesting because just today I was telling off camera, we were talking about this case that I have of this woman who has a C. diff woman and she had C. diff. We ended up treating her C. diff with antibiotics and also with FMT. And she just came down with a UTI.
Right.
And all of us are like, walking on eggshells. And, I put her on all of my herbs, which I have to say, generally herbs work. They are not working.
Is this her
for
first UTI or she's gotten them?
She has a history of having lots of UTIs. This is her first UTI post C. diff.
Okay. So, hearkening back to our FMT episode, there are 2 retrospective trials and 1 prospective trial of FMT for women with recurrent urinary tract infections that statistically significantly and clinically meaningfully drop them a lot. I have tried it only once and it didn't work.
Yeah, I mean, I guess
still,
I'm in one right now.
Right. So she had FMT.
She had FMT.
And did it take longer than you would expected? Or like for my patient, it was like, and then she had sex again, and then she got her UTI.
She has a partner. And
yeah.
So, but okay, but that brings us back to our original conversation, which is what I do if somebody has a history of C. diff and I can't get them to not take antibiotics because I don't want her to go into pylo, is class 1 high dose, 112 billion to 450 lactobacillus bifido, Saccharomyces boulardii class 2, and then bacillus class 3, all of them 3 times a day for the entire time they're on the antibiotics and for a month after. You are saying what you are doing is a mixture of apopectin and guargum.
Yeah.
It's cheaper.
Yeah, it's cheaper.
For sure.
And I, it's interesting because this is really in the past, just since the conference, since October that I've been messing around with this. And here's who I've given it to basically is people that I'm like, oh, you're on all these antibiotics for XYZ. I just want to protect you. So is it working? I don't know. Like they'd have to be in a clinical trial. Like
but anecdotally, what are you seeing?
I mean, I've got some cases of people who have not had obvious dysbiosis following these big courses of antibiotics, but I can't say if that's predictive. So,
I mean, here's the reality though. These interventions are relatively cheap and very safe.
Yeah, like at most you might get a little bloated.
Yeah, that's like really worst case scenario, it's a financial, very small ding.
Yep.
Right.
So how much, what's your dosing strategy?
So apopectin, if you give a ton at once, that is one that will really bloat you versus the sun fiber is kind of doesn't bloat you so much. So just 2 grams a day of sun fiber, have them up to it right away. And then I do like a 2-week program with the pectin where I start them at like a teaspoon once or twice, depends on how sensitive they are, but like once or twice a day. And they end up with 2 tablespoons 2 to 3 times a day, depending on how much they tolerate. Not everybody, but I mean, I have people who get up to that. That's kind of the maximum dose is like 2 tablespoons 3 times a day.
If they're bloated, do you have them continue? Like if they can?
If they're willing to, because I don't think that bloating is harmful to them. It's not a reflection that's causing dysbiosis.
I think it is just probably going to change also.
Maybe like if they're not too uncomfortable, just kind of power through it.
And it doesn't taste bad. Apopectin doesn't taste bad.
No, it's fine.
Yeah, I mean, there are other powders that we give people that truly taste bad.
Yeah.
Disgusting.
Now, here's a weird thing though. Most apopectins you buy on the market, they've got sugar in them.
Oh, yeah.
And so in a pinch, so I'll either have people do the capsules, which are pure apopectin, and they're just taking a ton of capsules every day. Or sometimes I've had people do modified citrus pectin,
That's what I
which,
was wondering.
Is supposedly absorbed more, but it bloats them. So it's having an effect on the microbiome. Totally. And then we found a bulk one that we're going to have at customprebiotics.com without sugar in it, but it's like, you have to buy 5 pounds worth at once.
Yeah.
Have you found prebiotics do anything for candida?
I haven't used it yet. I feel like I should come back and talk about this in like a year, but I have my shtick that I do for candida and prebiotics. I haven't worked into that.
Yeah, I also am not. I'm not sure why. I just modified my fungal protocol to add in enzymes, to break down the fungal biofilm, but it's hard.
It's hard.
Fungus is really hard. It's painful.
Yeah, I remember saying it's the Oregon State flower.
Yeah.
I heard that.
I think it's not just Oregon. Like hot cultures that have swamp heaters instead of ACs. ACs grow them. Like it's not just places where it rains all the time.
Yeah. Places. Yeah, I've had a bunch of people recently in my out-of-state consult practice who grew up in India.
Oh, right.
And it was hot and, mildewy and, that's just, they've never been okay since that. So
side note on candida, how often do you think people with these chronic candidiasis symptoms are really dealing with toxins produced by candida? And how many people are just having a hyperactive immune response to like maybe kind of small amounts of
Don't you think you develop, isn't it?
Okay.
Don't you get the hyperactive immune response to chronic candida?
I think a lot of people do, but then the thing is, it's like, is kill, kill, kill really the thing to do?
Right.
I mean, I do
Right.
it often.
Okay, so this
we had
brings
this
me.
episode.
So this
Mm.
brings me into one of my girlfriends who we're going to have on the show, Dr. Lori Mangato, who is a very, very complicated thinker. One of the things she got into is she got into allergy testing, allergy shots, allergy tests, and doing slit therapy. What she is now trialing out on her patient base is using basically candida slit therapy for these chronic candidiasis patients. And she is noticing that a lot of it is the hyperimmune response.
Right.
Which
And so
Dr. Kapadia talked about too. We had an episode talking all about that, and it was sort of mind blowing. Especially do you test Candida immune complex or any blood markers?
No, I learned a long time ago from Eric Yarnell. He was
Yeah.
like, none of those are reliable. Just
Yeah.
use the FRDQ7. But then actually at Hawaii Doc Talks conference, he backtracked on that a little bit. And
I think I was too. I was bulldozing on that one.
Yeah, I think, and it's the Candida immune complex. So I haven't started using it, but I kind of am curious.
But it
too.
makes sense because it's often persistently elevated, and
Mhm.
it's not a good marker for like if you're getting success in treatment,
Mm,
because I think of this immune response
right.
that may remain elevated even if you've eradicated a lot of the candida.
Yeah. So now if I have patients that are having this very, very chronic candidiasis picture, I am sending them over to Mangato,
Yeah.
Lori Mangato, for slit therapy as part of the protocol. I am doing less herbal kill because I didn't feel like I got great traction
No,
using
it's
herbal
hard.
kills. I'm using a little bit of pharmaceuticals.
Well, you've got stories. I know we all
Yeah,
have stories
yeah.
of
We
like
do it.
nystatin and
Yep.
touches diflucan, and we're maybe giving probiotics
It
and
just
berberine.
isn't like bacteria. Bacteria is
Right.
dumb. Like that's
Right.
pretty easy to treat.
Right.
The yeast, like, yes, of course, there's some
It's so
people.
patient. Yeast is so
Mhm.
patient.
It's so patient
Totally.
and adaptable.
Yeah.
And it's
It's
everywhere.
adaptable.
Yeah.
It's
Yeah.
everywhere.
Yeah.
I have this picture when I talk about biofilms about where where you get yeast overgrowth
Yeah.
everywhere on the skin, in every solid organ, in hollow organ. You know what I mean? Like where? Yeah.
It's so stressful.
Yeah.
It's
Okay.
so
So
stressful.
where else how much are you using prebiotics for constipation? How much constipation do you see?
I don't see a lot. And so this is a thing. Like, I really shouldn't be like, oh, let me talk
Yeah.
about prebiotics,
Yeah.
because here's my shtick for constipation is, well, so let me say, for like mild to moderate constipation, hydration, dietary
Yeah.
fibers,
Yeah.
sometimes some psyllium,
Move your
getting their
bod.
bodies moving.
Yeah.
What
Living
else?
like a human.
You know, little anthraquinone glycoside herbs if you need some center, something to get stuff moving.
Yeah.
Sometimes I don't mind that. Like, that's not that hard from
Yeah.
mild to moderate. But then severe chronic idiopathic constipation can ruin people's lives.
Yep.
It is, quality of life can be so low.
Yep.
And so I do like prucalopride. I know you like prucalopride.
Do you
too.
know that it is now really cheap?
Yes.
It just
cheaper.
became really,
Yeah.
really cheap.
Yeah.
Yeah. 'Cause
You
it
taught me
finally
that.
is
Actually, I think
generic.
I learned that from Turd Nerds.
Oh yeah, it's literally $15 for.
I think it was
a month.
January they released generic.
Yeah,
Yeah.
it's
So,
amazing. Okay,
yeah.
sorry.
Yeah. So prucalopride, it does not work for everybody, but when it works,
I know,
it
it's
can just be
amazing.
And
so
we
amazing.
have more drugs like that coming down the pipeline.
Oh,
I think I
Like
mentioned some of them.
5-HT receptor
Yeah,
agonist.
5-HT4. Yeah,
Cool.
so they're in trials right now, and hopefully
they will be expensive.
Lucitrog, and there are a bunch of them.
Oh, right,
So,
because they're new.
Yeah.
yeah.
Okay, so go on. So
And then lactulose, I like a
Yeah.
lot too, because it is an osmotic laxative. It's also Jason Howrelack's favorite prebiotic.
Yeah.
Doesn't
He
it
uses the
bloat
heck out of it.
constipated people?
Sure.
Yeah.
I mean, but what I'm looking for is, I'm like, you're going to go through some discomfort, and I
Yeah.
do a slow ramp up, or I'm really ramping up. And if I can get them with prucalopride and lactulose
Yes.
for like a couple months, and then I do an FMT,
Oh.
I have got like, and their
Oh.
FMT is in the literature for severe chronic
Amazing.
idiopathic constipation.
Think for like so I have a ton of constipation.
Yeah.
Me too.
So it's like one of my favorite things to talk
Mhm.
about. Do you think that it's working with the innervation? Because I think a lot of folks do have that kind of paralysis segments.
I wonder, I mean, I think I learned from you that there's something about nerve regeneration with prucalopride.
Yes.
And so that's why I try and give it for a while. And
Right.
sometimes people are like, I'm doing okay. Like, I was having like one bowel movement every 2 weeks.
Yeah.
Or never
Yeah.
Yeah.
without, manual reduction or whatever. And now I'm having like 2 a week. And I'm like, let's keep going.
Yeah.
Let's
Yeah.
keep going and get it
2
moving as long as we can.
years.
I
what
yeah,
I
I
do
think
for people.
it's either
2 years.
I
Yep.
usually go 3,
Yeah.
Wow.
and I am going to say 30% of my patients
Yeah.
can get off of prucalopride and maintain normal bowel movement.
Yeah. Which is better than literally any other option.
Right.
Yeah.
So, except
And
for
the
FMT.
side effects for prucalopride are really minor. There's a small handful, and I've definitely seen the mental emotional changes in like a handful of patients. besides that, the side effects are kind of
It's something in the 90% sensitive
Yeah.
to just enteric cells.
so
It doesn't
interesting.
bind to
Yeah.
heart cells or brain cells like all our other prokinetic drugs.
Right.
You know
which is
what
why it's
else
amazing.
works with those types of difficult populations is stopping working, like
Mm.
stopping revving their
I know.
nervous system. You know what I mean? Like
a lot of
that is,
cases
I
of that.
see, I have a
Shift
pattern.
work big time. They don't poop.
Mm.
Yeah, no, totally.
And even
yeah.
the drugs don't work because it's just their nervous system is
Mm.
done.
I do think that is the thing. Like I have enough history now of like my really chronic, difficult
Yeah.
constipation patients,
Yeah.
and they retire. Something changes. They get out of a toxic relationship,
Yep.
and all of a sudden their nervous system is like one perfect
But these
gallon a day.
folks
Oh.
have, so I've got a cluster of folks who had like pretty severe restrictive eating disorders in adolescence, which is
Mhm.
so common. And it's like their gut is paralyzed and you can throw stimulants or whatever. And you just have to flood the colon
Yeah.
to get anything out.
Yep.
And Integrity kind of works,
Yeah.
because it's a different mechanism. But like, what can we do for the nervous system to kind of retrain it to do its job
Yep.
is what I'm always after.
Yeah. And I played around. I've done like St. John's worts enemas,
Interesting.
large
Oh,
volume.
what?
But the thing is, I don't have any miracle stories
Yeah.
where it's just me
Totally.
thinking about like, what do we do that can support the nerves and the
Right.
nervous system that's
Yeah.
like really vital in
Yeah.
our tradition.
I mean,
Yeah.
I'm usually more likely to go like the brain retraining route.
Uh-huh.
Like,
Yeah.
can you go and like a lot of people that start with trauma just hold it
Yeah.
and they're holding it everywhere. And your enteric nervous system is only innervating your bowels. You know what I mean?
Right.
And so for those people, I'm like, I'm not saying this isn't a physical thing. There's definitely something happening. And
Yep.
there is a nervous system component to the thing that's happening.
Sure.
Yeah.
Everybody's favorite cranial nerve 10, the vagus nerve.
Yeah.
Yeah.
That's where we have the communication between the central nervous system and the
Yep.
gut.
Yeah.
And there's all these things that like our colleagues do. It's like gargling and singing.
The
and all
vagus
this.
nerve
The vagus nerve-
stimulation.
Chanting, drumming.
Yeah. And I can't say I've seen those
Me
things
neither.
move the dial a lot.
I think it's good for like upkeep.
Uh-huh.
We should probably do stuff like that.
I think
but-
that I use like the vagus nerve stimulators,
Yeah.
like
Right.
they're now FDA approved.
Right.
I think
Not for constipation though,
no,
right?
for
it's like cluster
depression.
headache,
depression, yeah. I think that I see them work in the right population, but I think it's not a big population.
And it's kind of labor intensive. Like
15 minutes twice a day, I
compliance-
think, is a study.
Yeah,
Yeah.
compliance is kind of hard on that one for the average person.
I have one more
Easier.
sidetrack maybe
Okay.
about constipation and so there's been all this chat recently about the SIBO study that came out showing that when you're doing a lactulose breath test, actually the lactulose is generally in the large bowel when we're
Huh.
getting these
Huh.
elevated readings. They did radio labeled lactulose. And so on all these naturopathic forums I'm on, there's all this chat of
Wow.
people being like, I knew it the whole time. These tests are not good. They don't show
Right.
anything. But I feel like they might not be actually representing small intestine bacterial overgrowth, but they're showing something because when the tests are elevated, people are more likely, like the literature shows, and we've all
Yeah.
seen it, they're more likely
And
to,
people
at least our
still
diarrhea
respond to
patients.
treatment.
Yeah.
People still
And-
respond to treatment.
And for constipated people who got FMT, there's a trial of like 200 people or something. They separated them out afterwards into two groups. Did you have a positive SIBO test or not? The ones who had SIBO, they had methane SIBO, were twice as likely to respond to FMT with
Wow.
remission. Yeah, with getting more than 3 bowel movements a week.
Okay, so somebody else we're gonna have on the show is Allison Seebecker when
Yep.
we can figure out a time to make
Yep.
it work. But I was like, Allison, when I'm looking at methane, right? When I'm looking at methane, am I looking? Is there a cutoff? Is that their 90-minute cutoff? And she was like, no. If methane is positive, methane is positive.
I mean,
Mhm.
The
especially if
whole
they're
test.
constipated,
Right.
right?
Yes.
And that's the whole thing.
And so I guess I'm like, I don't know if I get, okay. So I guess my thought process is, yes, I think rifaximin probably doesn't really make sense for those people. But with IMO people, you're never going to use just rifaximin on your own,
Right.
right? You're going to use what the literature says, which is neomycin or metronidazole, or what I like to do, which is nitazoxanide.
And that is
Right?
oxide.
Like I'm never going to use rifaximin on its own. Rifaximin does go into the large intestine some. It just seems to be pretty GI located. And so I'm like, I don't know if I care that IMO, that lactulose makes it positive.
Yeah.
Did they suggest using a glucose?
No, they
provocation?
said in the authors of this trial were
Yeah.
like, oh, this test isn't really showing anything. And I've been having this debate with Kathleen Janelle
Uh-huh.
on the
She's saying, I
Nat
told you that.
she's saying
Yeah.
we never should have been using this the whole time. Rifaximin doesn't like we shouldn't be using these tests.
Oh.
And I am a little bit devil's advocate because I don't do a lot of SIBO
Yeah.
testing anymore, but I'm like trying to stick up for the opposite point of view so we have some good dialogue in these groups. And I'm like, well,
Right.
I think the literature shows that people who have a positive test are more likely to respond to even just rifaximin than people who don't have positive
Right.
tests. People with IBSD, anyway.
Okay, so I am a little bit knee deep in this right now because of a contract that I picked up. But basically, what I have discovered is there are two very, very different groups who look at SIBO as a whole, right? There is the East Coast contingent, which is, I think, the American.
coast to
It
coast.
is so interesting. The East Coast contingent, which is, I think, the American College of Gastroenterology, and the West Coast, which is the American Gastroenterology Association, right?
Oh.
Two very different contingencies. East Coast is all about no testing, but if you're going to do testing, let it be glucose. West Coast is all about, yes, we think testing is good. We think lactulose is good. We think glucose is good.
That's Mark
We think
Pimentel.
that's Mark
Yeah.
Pimentel. We think lactulose is probably better,
Mm.
right? Very, very different. And I'm like looking at a study like
So
this, and I'm like,
Did the
I
East
will-
Coast sponsor this study?
I will
I
put
don't
money
know.
on the fact that it is out of an East Coast college. Yeah.
Interesting.
And it's so, and it's interesting because so I'm on the scientific advisory board of this lab company, and the other guy is an East Coast gastroenterologist, right? And so he really, like, I have to very much edit myself because I'm pretty pro lactulose. Like, I've been using it a long time. I believe in it. You know what I mean?
It's like to the point that SIBO I consider to be pretty easy to treat.
Right.
Wait, methane and hydrogen and methane? What?
Yes.
Both of them. Yeah.
I call SIBO pretty. If SIBO's your only problem, if you don't
Yeah.
have anything else growing in there too that's like problematic, I call it pretty dumb. Like it's pretty dumb to treat. We're gonna hit it over the head with the thing. You're probably gonna be okay to go.
So what are you using when there's methane? Because I agree with, like, I've seen so many cases where I'm like, rifaximin made your diarrhea go. But when people have methane and constipation,
It's rifaximin and
rifaximin and what does it for you?
just what Alana said.
Nitazoxanide.
Or I find the herbal treatments to be really successful as well. And I probably do those more than the antibiotics because for a lot of folks around here, I'm suspicious of mold and candida.
So it's like allicin and oregano and
Neem,
neem, berberine. Yeah, those are mine.
Yeah, biocidin, like to break up biofilms.
Yeah.
I will also, the disclaimer that I give everybody is there is no data to support nitazoxanide or Alinea for methane. There is one study that looks at hydrogen only.
Yeah.
And I will say anecdotally, that is the best reduction I have with less amount of side effects.
Yeah.
So nitazoxanide is so interesting because it's anti-protozoan. I think that's all it's FDA approved for.
Right.
It's also very
And only
antiviral.
Oh,
5-day course?
There are good clinical trials showing it's very antiviral.
What
It's usually 3
viruses?
days. It's BID for 3 days is
Yeah.
FDA approved.
Yeah.
And anaerobes.
Yeah.
Anaerobic
What
bacteria.
viruses were they studying?
I don't know. I
Not
don't
like
remember.
acute gastroenteritis. I mean, what else?
I
were
mean,
we
no,
studying?
it's not like for norovirus or anything like that. It's just like, I think it's just like in vitro data showing like in test tubes, it's like massively antiviral.
It is, and it does not have a lot of side effects.
No.
I mean, really, it doesn't.
Yeah. As drugs go, I like it.
For a longer course, people. I mean,
I
I'd
feel
say
like
it's middle of the list of side effects for people.
Okay, so it has 4 known side
Nausea.
effects: urinary discoloration, abdominal pain, diarrhea,
Eye
and
discoloration.
headaches. I should say any kind of discharge.
You might
color
turn
changes.
yellow.
Your fluid secretions might turn yellow.
That's kind of like the least bad side effect. That's kind of fun for a bit. But
No Steven Johnson syndrome.
yeah,
No allergy to the drug class that has ever been stated or documented. It might
it's better
exist.
than neomycin.
Oh my
Yeah,
God,
for
forget about
sure,
it. I
for
won't
sure.
use neomycin.
Yeah, but if we're talking about SIBO treatment, I mean, that's what a lot of people give is rifaximin neomycin
Right.
for
I mean,
intestinal
lots of people
antigen.
just give amoxicillin.
Just
Like
by itself?
By itself. No Xifaxan because rifaximin is still
Oh.
expensive.
Like naturopaths?
No,
And
no.
I think nitazoxanide is better tolerated than metronidazole. Wouldn't you say?
I think that it has better efficacies, but I mean,
I think it has better efficacy. I mean, metronidazole, I have seen like peripheral neuropathies for like really long courses, but
and neomycin, I have seen vestibular.
Ototoxicity,
Yep,
for sure. I've
And
seen it a
neomycin.
couple times.
me too.
but metronidazole, it's
Freaks me
like, it has side effects, but it's like usually doesn't.
Yeah, but it's metronidazole. I
temporary.
feel like first of all, you can't drink with it.
Right.
Yeah.
Second of all, I do feel like it just really messes the microbiome up.
Yeah.
I don't love that as an ash bath.
Yeah, it's a bomb.
Yeah,
it is
it's
a
a
bomb.
real
It is
bomb.
a bomb. But no, I like Alinea. The efficacy's better. And,
Yeah.
like, and then do you guys give long courses?
Yeah, I give a 14-day.
14 days.
Yeah.
And longer.
Yeah.
I give it.
I've given 30.
Yeah, I've definitely given 30 too. I used to do for protozoa and parasites
Yeah.
21 to 30 days.
And that's in the literature too for highly immunocompromised people.
Using it for 30
For
days.
protozoans, for like cryptosporidium and
Yeah.
stuff. Yeah, 30
It's
days.
just not covered.
Yeah. No. Not
Well, yes, but we have compounding pharmacies.
Yeah, it's not too
Yep,
bad.
not too
my
bad.
we do.
pharmacy definitely.
I just prescribed Digital Oregon compounding pharmacy.
Yeah.
last
That's
week.
right.
Yeah. So I feel like I should probably be bringing us back to prebiotics.
Yeah.
I probably should be using prebiotics after the fact.
Yeah.
I think that I missed Sharon's talk and I was like so bummed.
I think the way that I'm kind of looking at this is I'm a little underwhelmed with probiotics. Like,
I'm with you.
we use them. I think there's some cool data, but clinically, it's not a real game
Mhm.
changer for symptoms, you know?
Unless you drop a bomb. You
Right.
give like 2 trillion BID, which I do.
Then
I
the colon
kind of
just
leaves. Actually disagree.
Mm.
I feel like the way I view probiotics is they're like air conditioning. If you
Yeah.
find the right class
Yeah.
that works well,
Yeah.
you get symptom resolution.
Yeah. But
But
they're
then you
kind of
stop taking them and you're back to where you
they're
started.
kind of pricey. It's a
Yes.
little bit of shooting in the dark. We
Yeah.
have data all over the place.
Yes.
I'm just
for
like,
it.
it's because I don't live on like an organic farm,
Yeah.
have my hands in the dirt all the time.
Yeah.
Like we just always have probiotics in my fridge, and
Yeah.
me and my kids just take them because
Right.
I'm like, more bacteria.
It just isn't like the thing that cures diarrhea or like really
I think that it has.
regulates-
I have seen it cure diarrhea.
I've seen it
Not
turn
acute.
ulcer colitis.
But it's not our
acute.
go-to.
The data is good on ulcer colitis.
Yeah, and have you seen it?
Yes, I have seen
It's
it.
like usually people aren't willing to pay.
But it's
Yeah.
so
450 to
expensive.
900 billion. I'm seeing the 900 billion changing, you know?
Yeah, but it's the 900 billions, like 3 of those sachets twice a day. It's so expensive.
Yeah, it is.
Yeah.
It
Yeah.
is. That's what I mean. But so prebiotics.
Right. So I think of them just as like more gentle, more food-like. And so I'm in the process of learning how to use them and trying them out with different patients.
Don't you think they're helping quite a bit with inflammation too?
Yeah, if they're hitting the right microbes. And here's the thing too,
And
you guys.
just brushing things out. I mean, brushing out.
Yeah,
things in the
if it's
colon.
like the insoluble fiber
Yeah.
parts. Yeah. So I also think like maybe you can cause harm
With prebiotics.
in the wrong microbiome. You know, if you're
With
feeding
prebiotics.
in certain
Wow, I'm
complex
very curious
patients.
about this. Huh.
Yeah. So I like have
your
a
blooming things you shouldn't be blooming in there.
yeah. I mean, maybe it's just because I get like I know you
Yeah.
do too. I'm sure you do. Like get super complex patients
Yeah.
sometimes, and I'm working with a guy now who has like 35 to 50% relative abundance of lactobacillus in his gut,
Right.
and he gets D-lactic acidosis.
Yes,
and he feels like he is
Yeah.
drunk when that
Yeah,
blooms.
yeah,
It is
yeah.
so bad.
Can I
Yeah.
just say something about that?
That
I
is a
actually
thing.
just sent a letter, an email, because Medscape just published a study on this,
Yeah.
or maybe a clinical case that says this is a thing.
Yeah.
And one of our colleagues back at my old clinic, she totally saw a guy who had this, and the medical system was like, "You are a closeted alcoholic.
Yep.
Why don't you just tell us you're an alcoholic?" And he's like,
Totally.
"I have not touched alcohol in forever."
For
Yeah.
sure.
But
Because it
he-
makes you feel terrible.
He gets drunk on his own
Yeah.
microbiome.
Yeah.
That being said, the reality is a prebiotic, that's the wrong prebiotic, is going to make that person feel really bad.
Right.
And they will self-select out of that intervention.
I do think for most of
Yeah.
us, prebiotics are just a thing to sprinkle on, spring your treatment
Yeah.
plan. And the thing is, like, now we're gonna have like 15 or 20.
Yeah.
And I'm so excited to start like figuring out what happens, like asking Sharon for more advice, like what happens when you sprinkle different combos for different things.
One of the things that I do with patients is I make them, if they have like no detectable acromantia, I have them put together what I call an acromantia smoothie, right? Which is
It's appetizing.
kind of is. It's a bunch of like
Mm.
polyphenols, like
Uh-huh.
cranberries, like
I think
pomegranate.
you might want to rename it.
Really? Acromantia smoothie? That's not a good one?
No, I think we could rebrand that.
I think that should be our lead magnet.
Granted, juice powder or the rind?
Either.
The rind tastes so
Oh, no.
bad. Okay.
Pomegranate juice.
Yeah, juice.
Juice or pomegranate juice powder.
Great.
Wild blueberries, like just all
Yeah,
these
yeah.
great polyphenols.
Totally.
And then put in the prebiotics there, inulin
to help grow acromantia.
to help grow,
Yeah,
because
those
acromantia
probiotics
loves
are
it.
expensive.
Right. And then, and also, can we be honest? I've never seen acromantia change
I've
with the
tried.
probiotics.
Yeah,
Me
every
too.
once in a while because people really like are interested. It's trendy on the
Yeah.
internet.
Yeah.
right
It is,
now.
but the company says they're like, "Oh, this is live acromantia, and it will not engraft. Our product
Yeah.
will not engraft." They say that
It's
very
because it's air conditioning.
okay.
Like it's,
Uh,
I mean, yes.
Well, I just feel like so many microbes, they do not exist in isolation. They only can thrive with
Exactly.
their buddies
Right,
around.
right,
And when
right.
you take an acromantia capsule, whatever its best friends aren't there. So we need to
Exactly.
learn what its best friends are. We need to give more prebiotics to make it
Exactly.
feel like
Yeah.
happy.
Yeah. And it just, I feel like we just used to eat.
Yeah.
Right.
We used to eat real food.
Yeah.
And now we eat
But even our
imitation
food
food like
quality's
product.
down, and the average American, it
Right.
fewer doesn't happen. You know.
So I think what I'm hearing is I think I've been missing a huge subset of my patients and how I should be dosing them. I think that's what I'm hearing. I think I should also start even more investigating, because when I did a really interesting search where I was just like trying to chunk down prebiotics by amount of soluble versus insoluble fiber, assuming that insoluble fiber is going to make more symptoms that are going to worsen.
Yeah, it was mainly about tolerability, not what it's actually treating.
And in my data search, what I found is the one that is the most tolerable is the partially hydrolyzed guargum, the sun fiber. Generally, people do not really react to that. That's a great place to start.
It's a slow fermenter,
Yeah, great place to start and then introduce from there.
Yeah.
But we have a lot to shop from.
Yeah. And I will say, I also do like psyllium. You know, I do use it a lot because if people will like take the time and use it.
You have to titrate up for most people.
Yeah. Like most, except for sun fiber.
Water. You have to drink water.
Well, that's all of them.
For sure. Yeah, that's like the hardest part. I'm like, I can't tell you about this unless you promise me.
You know what I do? What my favorite little tradition is in the morning? I make myself a matcha latte with some kind of protein and inulin, because inulin is kind of sweet.
Oh yeah,
and it's completely dissolvable. Right? You cannot. So I use collagen peptides. I use inulin, and I use matcha powder.
And it all dissolves.
And it all dissolves, and it's like so warm, like in the middle of winter. Yeah, that's my favorite drink.
Good stuff.
Well, Dr. Davis, where can people find you?
Oh, I do telemedicine at foundational-medicine.com, and maybe by the time this comes out, some prebiotics.com will be open. We have a course on IBD on our main foundational medicine website, and that's where people can find me.
And I just as an aside, whenever I don't know what to do with a patient and I'm like, you're complicated and you need FMT, Mark is the person that I get the text. He is my text go-to.
I love it. I love hearing from you.
Awesome.
Thank you guys. Thank you, Mark.
Thanks,
Thank you.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the Turd Nerd word.